Hey folks, I'm Dr. Drew Sinatra. Now you may have heard in the news recently that there was an outbreak of E. coli. The particular strain is known as E. coli 0157, and they're thinking that it has come from romaine lettuce originating from California. And so you may notice that if you've gone to the grocery store recently, they've pulled a lot of the romaine lettuce, including all the different, salad fixings and packaged salads off the shelves because of the risk of contamination. Now, it happened mainly in October, okay? So a lot of people were sick. Apparently there was around 33 Americans and around 18 Canadians that got sick in October, and actually one case in British Columbia in early November. So you should still be aware that this is, still a problem. And if you do have any romaine lettuce still left in your fridge, you want to throw it away. And the term I've heard recently is when in doubt, throw it out. And the reason why is because normally, look, we all have E. coli throughout our digestive system, okay? It's a normal inhabitant. But this particular strain, which is E. coli 0157, has been implicated in lots of different contaminations, including spinach, and this case with romaine lettuce, and contaminated meats in the past. And what it does is, your body, once infected with it, which can take upwards of about 7 to 10 days to actually show some side effects, you may develop diarrhea, intense abdominal cramping and pain. The diarrhea may turn into bloody diarrhea. There may be some vomiting involved. You may or may not have a fever. And a negative sequelae from this can be the development of hemolytic uremic syndrome, which is essentially a form of kidney failure. So if you do develop, darker colored urine, and you're losing color in your face, and you're not urinating as frequently as you normally do, you definitely want to get checked out, go to the hospital, and get assessed, because this particular bacteria is a very virulent strain, and it can kill people, and it has killed people in the past. Luckily, with this particular outbreak, no one has died yet, but there has been, like I said, lots of different hospitalizations, in the United States and in Canada. So what I want you to do is, arm yourself with this information, because this, unfortunately, is not going to stop. We're going to continue to see outbreaks like this. It's just, it's going to happen with the size of our, industrial farming, and, the proximity of livestock near rivers and streams, and the irrigation that may come from that's used on the crops and such. It's going to continue happening. So, if you do develop these symptoms that I mentioned, and, you're not getting better, go to the hospital and get checked out, because this can be a deadly illness. All right, I hope you learned a lot here. Till next time.